Yeah, please go ahead.
Okay, thank you so much. Well, distinguished colleagues from all over Africa, it's my pleasure to welcome us to this second session of this conference. I do hope we have all had very nice tea breaks in our different countries. I just finished my own cup of tea now, and I'm very much refreshed to start this session. My name is Femi Oloyede, and I have the privilege of being called upon to anchor the session on fetal medicine practice in Africa, I guess. And again, I'm so delighted that I'm inviting three distinguished speakers to address that topic. We have just 20 minutes for each speaker, and I do hope we try to keep to that time as much as possible. After the first two speakers, we shall be having discussion before we move on to the last speaker to wrap it up. So once again, it's my pleasure to be here at the invitation of the Zimbabwe Fetal Medicine Foundation and to moderate this session. Well, the first session is going to be taken by one of our distinguished members in the person of Dr. Malede Birara. Dr. Birara practiced in Ethiopia and as an associate professor of fetal medicine, she has actually, well, practices at the moment as specialist in St. Paul's Hospital, Millennium Medical College, Ethiopia, having trained from different parts of the world, including Ethiopia, United States of America, King's College, London, and Italy. Of course, there are very many publications, more than 20 really, in this subspecialty, and has worked for many years as an OBGYN specialist, and in the last 5 or 6 years as a maternal-fetal medicine specialist. Of course, mentor to many fellows in the college. It's my pleasure to invite Professor Malede Birara to please talk to us in the next couple of minutes on the experience had at the opening of Fetal Diagnostic Center 6 years in Ethiopia. Dr. Birara, over to you.
Okay, thank you so much. Can you hear me?
Dr. Birara, are you there?
Can you hear me? Can I proceed?
Hello?
Hello.
Dr. Birara, are you there?
Yeah, can you hear me?
Yes, we can hear you from this side, Dr. Birara.
I can't hear you very well, but
okay.
I do hope that.
Okay, great. So
very good. You have the floor, Dr. Birara.
Yes, I'm proceeding. Okay. Because of some technical problem, I think my slides are being shared by my colleague from Harare. So I'll be proceeding from here. So thank you very much for the generous introduction, Mr. Moderator. So to begin with, as an introduction, as you know, fetal medicine is a relatively younger field in general. It has been flourishing over the past 3 to 4 decades in Europe and the US. And it is very, very crucial in reducing maternal and prenatal mortality and morbidity. But in Africa, the service and the training is at its infancy stage. And my college is one of the hospitals which has pioneered or started the service and the training in Ethiopia and probably also in Africa over the past 6 to 7 years. Next slide. Next slide. Hello. Hello. Hello.
I can hear you very well here, Dr. Birara, but we have a challenge with the slides presentation, and I guess that is from Zimbabwe there. Can somebody please assist Dr. Birara to get the slides going effortlessly, please?
So as you can see from this slide, this was the gate of the hospital, St. Paul Hospital Medical College, which is one of the largest medical colleges in Ethiopia. So we have started MFM Specialty Fellowship Program 6 years ago, back in 2016. And the training started by just taking four fellows, and then we had one perinatologist who was trained in Europe as a mentor in the hospital. So we had also visiting professors from University of Michigan and Thomas Jefferson in the initial time of the training. So the training objectives were to establish early diagnosis of fetal abnormalities through first and second trimester advanced ultrasound scanning, including fetal echocardiography, prenatal diagnosis through invasive techniques, and introducing intrauterine fetal therapy, management of high-risk pregnancy and detection of placenta accreta, growth scan, and detection of fetal growth restriction. So these were the learning objectives in the fellowship program. So the fellowship program initially took 3 years, and then it was conducted under supervision of in-country and foreign supervisors with practical attachment close to 5 to 6 months in Michigan University, Thomas Jefferson, and King's College in London, and also in Italy, in Sardinia. The fellows also attended some 2 to 3 conferences in the Society of Maternal Fetal Medicine and World Fetal Medicine conferences. So afterwards, after the first group has graduated, in the subsequent years, the college had enrolled additional fellows, and as we speak right now, we have graduated around 11 MFM specialists, and of whom 50% are working in the college as a faculty, and the rest are working outside of the hospital in other universities. So currently, as I said, we have 6 faculties working in the hospital. So these are some of the faculties and the fellows, which was a picture taken upon their graduation and examination. So the next slide. And this was a picture taken, as you see, from the middle 3 are the second group of fellows who graduated on the third batch of the training. This is the lobby of the hospital. Next slide. Next. So the most important milestone on the training of maternal fetal medicine in the college was the establishment of the Fetal Diagnostic Center. So it was established at the same time when we started the fetal medicine fellowship program. So the center is equipped with adequate number of 3D, 4D ultrasound machines, counseling room, and the procedure room where amniocentesis is conducted. We had adequate number of amniocentesis sets. And we also give intrauterine transfusion, and we have adequate number of intrauterine sets. And there is a memorandum of understanding and partnership between a private genetic lab, which is located some 10 kilometers from the hospital. And then we work in close relationship where we send samples to this genetic laboratory. So this is a Fetal Diagnostic Center, and this is the lobby of the center. Next slide. Which is well furnished. Next. And this is a fellow who is conducting anatomic scanning for a patient who is currently under training. And this is one of the ultrasound rooms that we have in the center. So this is, the ultrasound room has been divided into different rooms, and we conduct advanced scanning, nuchal translucency, fetal echo, and the procedure room and the like. So this is structured in a way to mimic that of the Fetal Medicine Center in London to some extent. So we have some activities, but when I present the activities, I have some problems and limitations. There was no adequate registration, and the registration was incomplete. And then the data that I'm going to present might not be the real data or representative. There might be some data which has been missed. So the activity that we conducted might be much bigger than the one that I'm going to present. Next slide. So regarding scanning, over the past 6 months, we have conducted more than 10,000 scans, including first trimester nuchal translucency, second trimester anatomic scanning, fetal echocardiography, and different levels of Doppler study, umbilical artery, ductus venosus, and middle cerebral artery, growth scan, and the number of abnormalities detected were not documented, but in 2 years' time, we have collected around 1,000 abnormal findings from this scanning, and this is the one of the rooms, okay, where we give counseling room, and then we have conducted 500 patients with serum analysis testing and NDT, but because of the lack of agency, this testing has been interrupted, and we don't have a bigger number of tests using serum analysis. So currently, we just use only ultrasound findings to conduct for further invasive tests. So this is the counseling room. When we come to the invasive diagnostic tests, as I have said earlier, we have a partnership with a private genetic lab, and then after the patients agree, after counseling, we send samples to that private laboratory, and so far we sent 160 amnio samples to that hospital, and then from that there were 30 cases of aneuploidy detected over the past 4 years' time, and there is no complete documentation. There are few cases who have opted to go for cell-free DNA, and the sample is taken to Dubai or London. And the technique that the laboratory uses is a FISH technique for genetic analysis or chromosomal analysis. Next slide. So when we come to fetal therapy, one of the objectives of this center is to conduct fetal therapy. Even though we took advanced training in London and in the US, currently we are only able to conduct intrauterine transfusion in the center, and currently close to or more than 130 cases of intrauterine transfusion has been conducted over the past 6 years, and this has been published on paper. Probably tomorrow or later in the afternoon, Dr. Abdul Fattah might present the summary of this presentation. This video clip shows one of the fellows conducting intrauterine transfusion in the center. Probably if you play the video, the clip, we can see how it is being conducted there. Okay, next slide. Okay, another important aspect of this center was the quality of care given for high-risk pregnancy has improved. As I have said, high-risk pregnancy, especially those complicated by medical problems, are being followed by MFM fellows or consultants, and from whom, if we detect growth restriction or some kind of problem, then advanced Doppler study is being conducted. So it has contributed a lot for the quality of high-risk pregnancy and to the reduction of maternal and perinatal mortality in the hospital. When we come to the training, this center has become also a center, a hub for training for residents and fellows coming from countryside, other hospitals and other universities in Ethiopia, and also abroad from like Rwanda and Somaliland. So we have fellows and residents who are constantly attaching in the center. It has contributed for the increment in the quality of the training. And we are also currently receiving referral patients, particularly for intrauterine transfusion from neighboring countries like Kenya. So it is becoming a regional hub now. So this is a training given for fellows who came from another hospital at the center. So as I said, it has contributed for advancement of particularly scanning for fellows who came from outside of Addis Ababa. Okay, next slide. Next slide. Okay, so the future plan of this center is to expand the center more, particularly in order to be accessible for like other countries in the region, like South Sudan, Eritrea, and Somalia. And the other future plan is to establish a fetoscopy center. Currently, we are planning to procure fetoscopic machine and then to start fetoscopic procedures. But for that, we need additional training, and then we are planning to have some kind of short training because we didn't conduct the fetoscopic procedures for some time. We have lost some of the skills. That once we get the training, this is our future plan for establishing fetoscopic procedures. Next slide. So the last slide is, I think, about the limitations. We have limitations in the center, as I said earlier. I mean, we are overwhelmed by a large number of patients coming from everywhere. And then the other one is we have a limitation of space and availability, constant availability of reagents for genetic laboratory. We don't have a genetic lab in the hospital. We are sending samples to private hospitals in Addis Ababa. And then the other limitation is the lack of fetoscopic and other advanced machines, which has limited our practice to go into a higher level. So these are some of the things that I wanted to share you, and this is my presentation. Thank you very much, Mr. Moderator, for the time.